Welcome to the Eat Away Kidney Stones podcast. I'm your host, registered dietitian and kidney stone expert, Melanie Betts. After learning a ton about kidney stones and helping people prevent stones at the University of Chicago, I was fed up with all the terrible advice people were finding online. So I decided to do something about it. The Kidney Dietitian was born. This podcast is for people who want to learn what actually works to prevent kidney stones and still enjoy life, eating, and their favorite foods. Let's dive in. Hello and welcome to the 121st episode of the Eat Away Kidney Stones podcast. As always, I'm your host, registered dietitian and kidney stone expert, Melanie Betts. And today I am thrilled to welcome another dietitian to the podcast. Her name is Courtney Watring, and she will tell you a little bit more about herself. But this is a little different. I've had dietitians in the past talk about nutrition-y, dietitian-y type stuff. But Courtney is here actually as someone who has been dealing with kidney stones herself. And so I just wanted to kind of chat with her what it's like to be a dietitian who also, I don't want to, ruin the punchline, but it sounds like might still be kind of struggling to figure out what to do for kidney stone prevention, even though you are a dietitian yourself. So that is what you are getting yourself into with this podcast. So Courtney, welcome to the podcast.
Thank you. Happy to be here.
Yeah. So share a little bit about yourself. What do you do? What do you specialize in? Where are you? Just let our listeners know a little bit about who you are.
Yeah. Well, as you said, I'm a registered dietitian as well. I do outpatient work, so I see all of my clients actually virtually in the outpatient setting. My focus is eating disorders. It's where I started. It's where I found my passion. So supporting those clients with obtaining recovery or maintaining recovery.
Mhm.
Um, But of course, I also do a little bit of general nutrition or gut health or helping those with neurodivergence with supporting with meal planning and grocery
Awesome.
shopping. Oh,
Awesome. Good
yeah.
for you. Where did you go to school? Just wondering, where did you your internship and all that good stuff?
Yeah, I did undergrad. I'm in Missouri, stay in Missouri. So my undergrad was in St. Louis at Fontbonne University, and then I did my internship through Southeast Missouri State at.
Awesome. Good for you. I have to say, when I was a dietitian student, I was interested in eating disorders and got just a little taste. And honestly, I learned that's the point of an internship, right? You kind of learn what you like and don't like. And I was like, oh, this is so not for me. Like it takes a special person to work with that population. So thank you for what you do. That's such needed work.
Yes, I love it.
Yeah, awesome. Kind of moving into kidney stones. I don't even know your story. I'm going to be learning as as you talk. So you've struggled with kidney stones yourself. Kind of what's your history of kidney stones? What's going on there?
Yeah, so my first encounter was actually my last semester in undergrad.
Oh,
Yep.
yeah.
It was like very start of the semester too. So January, woke up and I was like, don't feel great.
Okay.
Screen. I was like, this is interesting. Maybe I should go to the bathroom, right? My stomach kind of hurts.
Hmm.
And then started like getting nauseous. I had blood in my urine. I'm like, I think I'm just gonna go to urgent care, not gonna go to class
Yeah.
today.
Yeah. And then you found out it was a kidney stone.
Well, actually, at first they were like, it might be a kidney stone, maybe it's a UTI. We don't really know. And I was like, well, I've had a UTI before. Sure, that's probably what it is.
Hmm.
Antibiotics. A week later, I'm like, this still doesn't feel great. Did another round of antibiotics. They're like, maybe you should get a PCP. I'm like, that's probably smart in general.
Yeah.
So went there, got connected with the urologist, did a CT scan. Yes, recognized I had a kidney stone, which was a shocker to me because no one in my family has ever struggled with it. This was my first
That was one of
experience.
my questions. Okay.
Yeah, ever hearing about it. So had to end up doing, a standard treatment of lithotripsy and a
Okay.
stent. Um, Went back for a checkup maybe a couple months later. Kidney stone fragments were still there. And so interesting caveat to that was now I'm towards the end of the semester. I'm actually planning a wedding. We were going to get married that summer in between, of course, undergrad and internship. So the urologist was like, well, you could not have to do it again and kind of risk, is it going to
Oh,
pass
yeah.
your wedding day? So I'm like, let's not risk it and just to get it over with. And so ended up doing that. And that was like a couple of weeks before my wedding, but I think it was worth it overall.
Yeah.
first time
Yeah, the
experience.
last thing you need on your wedding day is another thing to worry about going wrong. Like you certainly don't need to worry about passing a kidney stone that you know exists on your wedding day. That sounds terrible. So,
Mhm.
yeah. How would you say, I know I have a lot of students in my course and people who ask what it's like to go through lithotripsy or ureteroscopy or, and any of those sort of stone removal procedures. Can you share a little bit of insight as to what that's like and specifically what the stent is like? Because I know a lot of people are very concerned about the stent.
Yeah, so that was my first time. I did it, had to go a second time in 2023 as well, which we can
Oh,
talk.
okay. Sorry, I jumped ahead. Yeah.
I've had two experiences with it. I mean, the lithotripsy part, like you go under, so like that's pain-free, you're not awake. I think there's always question about that. I remember waking up and you're always just a little sore right in the back area where they're kind of doing it or wherever they're targeting it at.
Yeah.
I feel like the stent is not fun. I'm not going to sugarcoat
Hmm.
I don't know if you've heard other experiences, but yeah, just not a comfortable thing. It feels like you just have to go to the bathroom all the time. Again, I was lucky or unlucky to work from home, so I'm like, okay, I can have access to a bathroom or that need if needed, but I couldn't imagine having to go into an office and plan that around or other positions and work that you might be
Yeah.
with that.
Yeah. I know a lot of people, well, not a lot, I should say, it has been said that the stent can be worse than the kidney stone itself. Would you agree?
I would say pain wise, no. I was just say annoying.
Different. Yeah.
Yeah.
Yeah. Yeah, and
Uncomfortable.
stents are so tricky because it is, it sounds like there's no way that we can kind of predict what will like how your experience will be. Some people will say it's totally fine and it doesn't bother them at all. Some people will say it's worse than the kidney stone themselves, and some people say it's annoying. Some people say it's painful. So it sounds like it's kind of unknown, which is scary in itself, just to not know how your body will sort of react, if you will, to that stent or how it'll feel.
Right. I think even going into the procedure, the doctor is always like, we might need a stent. If needed, we'll put it in. I'm like, do what you need to do. But I think even that, like planning for it afterwards is a little unknown, at least in
Right.
of like, am I going to come out with one? And is it going to be fine? Is it going to go well? So that can be difficult within
Yeah.
itself.
The unknown is always a scary, sometimes worse than the actual reality of things, for sure.
Hmm.
Yeah. Okay. Do you want to share anything more about, so I kind of cut you off about the more recent bout with stones in 2023, you said. Anything of note there?
Yeah, it's very somewhat similar. So I was in my career, we're actually camping. My family and I were big outdoor people and we were camping and I was like, I'm getting some weird back pain. And then I kind of knew a lot quicker than the first time of like, oh, I think I know what this is. I was like, maybe
Hmm.
a lot of water, it'll be fine. Had to go to the ER,
Not
terrible
fine.
back pain, throwing up, right? And so that was kind of my last experience with it was that. And so obviously very similar treatment with a tripsy stent. And I
Hmm.
think there on, I'm like, all right, maybe I need to take this a little bit more seriously, or maybe this is obviously not just a one-off experience like I thought that very first time.
Yeah. Yeah. So it sounds like your stones have been large, I'm assuming, since you weren't able to pass them yourself and you had to go in and have some sort of removal procedure. Do you know how big they were?
I don't remember. It doesn't sound like a lot, right? A couple millimeters, but then with
Well, I mean, I mean that's big enough. Yeah. Yeah. Okay. So you mentioned that you wish, or like the second bout, you sort of were like, okay, maybe I have to start taking this seriously. Now that you do have sort of that mindset, and that was you said in 2023, so that was 2 years ago. So like what do you is there anything that you kind of wish that you knew earlier that you know now? Kind of looking back and realizing that this is not just a one-time deal. Like what do you wish that adolescent Courtney in college knew?
yeah, I think just to take it more seriously. I've always was always terrible with hydration in college, drinking or just growing up in general, like water intake was like, yeah, sure, I'll drink some water,
Hmm.
sports. I'm like, yeah, I'll do it during practice. But some of my family, like just growing up, I feel like water just wasn't as big of a deal as it was now, or kind of I'm
Yeah.
water bottles are such a
It's
big
like
thing.
trendy now.
Yes. So I think taking hydration into account, I think I very quickly after the procedure the first time, I'm like, this is not fun. I don't want to do this again. Let me, drink some water or whatnot. But I think that kind of trailed off as I got to get into my career and internship and, still going
Life
through.
happens.
Yeah. Um,
Hmm.
but I think looking back as well, like I don't think I got a ton of information as well at both times. I kind of got that like in your discharge paperwork, here's a low oxalate diet. I wasn't told whether to follow it or not. I was like, what is this? Uh, so again, even as a dietitian, I was like, what does this even mean? This is a lot of the things I like to eat. And so again, that first time, especially, I think, how do I prevent this or preventative care wasn't always a focus of my mindset. Again, I was just like, this probably just happened once. I probably just need to drink more water.
Hmm.
And then obviously that second time kind of woke me up a little bit.
Yeah.
You more about that.
Yeah, yeah. And I so wish, and I'm probably, stealing your thunder later, but I just so wish this is why I do what I do. I so wish that doctors told people, especially young people, because we're all kind of dumb when we're young, right? Like they're, in fact, that's the young generation, or when you're younger, you're called it like the invincibles. Have you heard of this term? Right? Because you just feel like it's not going to happen to me, like it's fine. And even when you have a kidney stone, when you're young, you're way more likely to be like, oh, it's fine. Like, I don't need to take it seriously. Like, I'm healthy, right? But I feel like you are such a great example of kidney stones are unfortunately an equal opportunity uh, disease thing, right? Right. You don't have a family history. Like, unfortunately, just anyone could potentially get a stone, and 10% of the population or so will have one at some point in their life. And then that recurrence rate is so, so high. And so I wish that doctors to young people and all ages of people obviously really took this preventative thing more seriously from the get-go, from just stone number one, knowing that there's up to a 75% recurrence rate when you look at lifetime stone recurrence, which is just crazy.
Yeah, absolutely. Yeah. Again, it wasn't even maybe talked about, right? The first urologist I went to was like, all right, just like let me know if you need me. Luckily, the
Hmm.
oncologist is like, let's schedule follow-ups, even, year out. But I think, right, again, as in your college, you're like, I didn't have a PCV to before all of this. I have
Yeah.
appointments now, it's fine.
Yeah,
So
I don't have time for this. Yeah. Yeah. So what do you kind of wish that more people knew about kidney stones, thinking about it both from a general health standpoint as well as from a health professional dietitian standpoint?
yeah, I mean, as we said, like the seriousness of it, like it can get serious very quickly. I've heard
Mhm.
people get, septic from it, or they go too long and they're causing kidney damage. And so, again, I was just like, maybe it's a UTI, or what is even happening? Maybe I just have like a back cramp from sleeping weird the night before. So, I think just recognizing the symptoms of it is not talked about. Right? I called my mom, and my mom's like, I don't know what's going on. I don't
Hmm.
have idea, the clue of what's a symptom of an eating disorder. So I think just the awareness of it. Um, and I think in general too, that it's not a one size fits all approach when treating it and taking care of it. Uh, so I wish that again more people got that understanding or that support of, this is what you're a list of all these foods that you need to be doing, but is this even relevant to your kidney stones or what you're
Right.
doing or how your, what your lifestyle looks like, which I think can be very confusing from what I've witnessed as well.
Yeah. Yeah. Um, I have I don't think I've done a whole episode about this, but intermittently in my content, I've had conversations with people how um two things. One, there is actually a connection between eating disorders and kidney stones. There's certain things like laxative abuse or vomiting, right? There's all sorts of different mechanisms of how those things can increase risk of stones. Unsurprisingly, it doesn't research that much, so we can't talk too much about it. But we definitely know that there's an association between a variety of types of eating disorders and disordered eating and kidney stones, which I think so. It's great that you're here, and I just wanted to point out that connection. And two, I've found just through talking with people, I feel like people who have had kidney stones and who are terrified of having another one are very susceptible to disordered eating practices. Because I fear it's exacerbated by the lack of quality preventative information that is given, right? People are like, okay, you just went through the worst thing in your life, worse than childbirth, right? So many people say. And then you're like, okay, well, here's this thing called oxalate that you can't eat anymore. And here's like some terrible information. You can't eat protein, you can't eat salt, you can't eat oxalate. Like, good luck, go on your merry way. And it just breeds this extreme fear of food and eating that I have found many people fall into true eating disorders, diagnosable or not, or certainly disordered eating and fear of eating. People losing massive, scary amounts of weight because they are just so afraid to eat anything out of fear of forming another stone. So I don't know if you have any follow-up thoughts on that, but I find it's heartbreaking, honestly, like how people just are so afraid to eat after having a stone so often.
Oh my gosh, absolutely. Again, as a dietitian, I felt that way for
Hmm.
especially that second time when I'm like, okay, this is no joke. This is not fun now that
Yeah.
like in a career, right? And I found for myself, I'm like, well, all of these foods that are on this list is what I like to have, especially from, a mom. I work from home. I'm seeing clients back to back. Peanut butter, nuts, trail mix, like those are my go-to like snacks to get in some, nutrition throughout the day, fruits and veggies. And so I found for myself for several months, I'm like reflecting back, I was like, I was really low in protein because my go-to was like a peanut butter sandwich in the morning and,
Hmm.
nuts and trail mix, spinach I was loving. And so I'm like, well, I took that away and strawberries and my vegetable and fruit content intake was so low for quite a while, just because, as you said, the fear of that happening again, having to go through it again was so high that I was like, I do not want to experience it again. But then, right, zooming out, which is so funny because I do that with my eating disorder clients, like, let's zoom out. What do we need overall for a healthy lifestyle? And I was like, I cannot be this restrictive anymore. And where's that balance of a healthy lifestyle within that?
Right. It's truly impossible, in my opinion, to follow a strict low oxalate diet. Like avoiding spinach and almonds, fine, right? That is two foods. There are thousands of foods on this planet, but following a true strict low oxalate of a 50 or 100 milligrams, the lowest I've heard is someone told a doctor told one of my students to follow a 30 milligram oxalate per day, to which I just like, doctor, can you please put together, show me a meal plan with 30 milligrams of oxalate that has any amount of adequate calories that is not just steak? Like, please give me that that meal plan. But anyway, I digress. I truly feel like it is impossible to put together overall healthy dietary pattern while you're strictly restricting oxalate like that.
Absolutely. Yes.
Yeah.
For it's of
Yeah.
that.
So what would you, if you could like wave a magic wand, how would you like to make this situation better? The situation of leaving patients with kidney stones so afraid to eat, and lack of prevention. Like what do you feel like needs to happen at sort of a public health level, I guess, for this to be better?
I mean, I think so many aspects of healthcare as dietitians, right? We were more involved, right? We're like a side hand person in those experiences, and so um, I think it would be amazing to have that support of a dietitian. That the urologist is immediately like, okay, part of our follow ups is you're going to see a dietitian, and let me connect you with one, or just some more information outside of that. Because again, that first time. I was like, I think I may have just thrown the handout away because I was like, oh, this is fine. Let me maybe
Yeah.
I'll second
Right.
time a little bit differently. But again, as a dietitian, I was like, what in the world? Like, how do I even follow that? And there's nothing else given, right? So then you're led to let me Google information, and you're given so many different things. And of course, right, as a dietitian, I'm trying to find other dietitians, which led me to you. But that's just such a confusing aspect. So I think that's part of it is wishing that there is just more information, maybe more follow up that we're kind of keeping this in track, right? You're checking in with your urologist or PCP more frequently
Hmm.
as a recommendation, or even just like that is what you have to do.
Yeah.
I think another aspect of this that I'm thinking of is from being in Missouri, and potentially you can relate with being in Illinois, is like rural health, right? And rural health.
Hmm.
I'm a little bit outside of St. Louis, like an hour, and I wouldn't even call our where we live rural, right? Because we're just off the interstate, but access to urologist in my area is very difficult. So I either have to go an hour to see my urologist, or he comes once a month to our local rural hospital. And so I think that's also a big barrier that I wish I just always want to advocate for the rural health providers to seek that, because I think that, again, for myself, can be a big barrier of getting checkups and taking this more seriously and getting that support when that can feel more limited.
Yeah, definitely. Have you found or have you explored working with urologists virtually? I feel like that is one silver lining of COVID that has stuck around pretty well, a lot better than I anticipated is telehealth. So, have you found that that is an option at all, or that's not offered, at least with this particular practice?
The practice I'm at, I'm not aware of it. Usually,
Yeah.
too, right, they want like the KUB X-ray to check in, which I love. I'm
Yeah.
like, yes, please let me know. Do I need to like what's going on in my body?
Right, right.
So I can feel like that can feel a little bit more limited, but I think that's a
Mhm.
great option that even as just like a check-in virtual, again, someone who works virtually, I think that's always a great access.
Yeah. Yeah. And certainly dietitians, right? Like we don't need to see you necessarily. I mean, there's a benefit, right? It's always nice to see someone in person, but I think especially for these super specialized professions like kidney stone nutrition, for example, I think that the internet is really a great way to connect with people since there is such a shortage of dietitians who are familiar with this, which leads me right into my next question. So, do you feel that dietitians are well equipped to help people with kidney stones? And what would you do again if you could wave that magic wand? What would you do in that realm of things?
Yeah, it's so funny because when I had it in undergrad, my kidney stone, it was like a month later in my advanced nutrition class as we talked about kidney
You talked
stone.
about kidney stones? I'm impressed you talked about them at all. That's wonderful.
I'll say I'm a great professor. I mean, it was like a one PowerPoint slide, and I remember hydration, sodium, and calcium was like the highlight of it.
Okay.
Uh, And so I always remember that in that class. But I think otherwise, no, right? Again, similar with eating disorders, it's like maybe you talk about it for one class period and that's it. Um,
Hmm.
and so I wish that there definitely was. Or, I mean, I think there is obviously with technology, right? Lots of access to get kind of more further training. But definitely in the experience I've had in outpatient, I've definitely had other coworkers that are like, I have this client. They're told to put on a low oxalate diet. What do I do? I feel like this is restrictive, but this is what the doctor says. And so
Yeah.
and I think that I think this shows that there is definitely a gap with getting support in terms of kidney nutrition to support.
Hmm. Yeah.
Uh,
Why do you feel like that gap exists? I have my thoughts, obviously, but why do you feel like kidney stones are just not taken seriously? It's not part of our curriculum, right? We're not required to learn about it like we are heart disease or diabetes or IBS or whatever it is, right? Um, why is that? Yeah, why aren't they taken seriously?
Great question. I would love to know your thoughts on it. I think it, as you said, right, we really focus on undergrad as like gut health, heart disease, diabetes, and I don't know if that's because it's just so common in our society, or if that's just like the main things, or if
Yeah.
education can definitely be updated on all areas to kind of make it more relevant and whatnot. But I think that's a really great question because obviously, right, if all urologists are handing out this diet and then there's no follow up, and if that's the main treatment of it, right, how are we preventing it when we're not having that education and giving that support to
Yeah.
us? It's
Yeah. Yeah, I have so many thoughts. I feel like the overarching thing though is that they're just not taken seriously. There's a lack of understanding in among medical professionals, both doctors and dietitians, about how serious it is. Like people know they're painful, but do people really understand how recurrent they are? Do people understand that there really is good research that shows that there are things that we can do to prevent them, right? I feel like that I know that prevention is not standard part of urology fellowships. And so there's just sort of a lack of understanding about that prevention piece. But quite frankly, they don't have time to do it, right? Like there's a bit of a debate going on in the world right now about whether doctors should be required to take nutrition classes. And although that's wonderful, like certainly I wish that doctors knew more about nutrition, like they do not have time to actually sit with someone and actually understand what they're doing and dive into things. So I feel like that's where dietitians come into play. So I think that there's just this lack of understanding about like that there are things that you can do to prevent them, that they are so recurrent, and also that they really should be seen more as this chronic disease. I feel like we're viewed as this one-time thing, right? But they're associated with a higher risk of high blood pressure, heart disease, and also kidney disease, and all sorts of other things. And so, really kind of viewing it more as this chronic disease, which is just as prevalent as diabetes. Fun fact. We know all about diabetes, but we don't know about kidney stones. I feel like that's kind of where that disconnect is coming from. It's seen as this one thing that really sucks, but like, meh, like you're sort of this is what you were given, as opposed to this chronic thing that can be prevented. That's where I wish that we could sort of shift that mindset as a profession.
Oh my gosh, yes, I love that. I think that's so helpful. I'm like thinking about my own experience. It'd be so nice
Yeah.
to have that talk of like, here's how you can prevent it. Because I think I felt lost, right? Both times of like, well, now what? Do I just expect the next one to pop up and to go over this all over again?
Hmm.
Which kind of dove into my own research and I hate that, right? I hope I'm sure other patients, right, though have experienced that of like, I have to do my own research potentially to kind of figure out more of this if I don't want to go do this over and over and over again.
Right, right. And that just leads you to such this scary road because, as you pointed out earlier, it really is different for every single person. So, because you are sort of left desperate, you're left to go online, you're left to what random people are saying in Facebook groups, which obviously is nice to, have that camaraderie, I suppose, but dangerous when it comes to truly getting personalized health advice because it is so, so different. Of course, not just based on stone, based on your risk factors, based on what you like to eat, based on other medical history that you have, like so many other things come into play as to what's going to be best for you. It really is just kind of a sad situation, quite frankly, and that's why I do what I do.
But research is very limited. Yeah, I
Yeah,
remember being like, "Can I have Sprite?" And they're like, "Yes," and other people are like, "No," and then some people are
right.
like, "Maybe." And it's like again, the information is also not always consistent, or again, it's so individualized. So maybe for some people, and maybe definitely not for others, right? So it's,
Hmm.
as you said, very confusing.
Yeah, it's very confusing. But hopefully less confusing now that you found me. I hope. So it sounds like initially you did kind of go down that low oxalate route, but you've discovered for yourself in trying to do it, you're like, this makes no sense. I cannot eat a healthy diet. I'm a dietitian. I know what is what is healthy, and this is not it. I am a whole person, not just kidney stones. I have to address everything. So what are you kind of focusing on now, if you don't mind me asking, in terms of what things are you mindful of when you're making your food choices from a kidney stone prevention standpoint?
Yeah, I would say hydration is my number one. Always trying to kind of aim for an amount. Before it was maybe 30 ounces a day, growing up, especially in high school. And now it's like, okay, I'm really trying to get higher. So that's always like my main priority throughout the day. Um, and then otherwise, again, as I would say for other clients that I work with, is just kind of zooming out. Like, it's okay if I have chocolate. It's okay if I have these foods. It's just thinking about what else pairs with it. So if I'm hydrating, if I'm having calcium right throughout the time, right? Because if I'm not having protein or enough fiber from fruits and vegetables, what other things is that going to prevent or cause, right? Versus just potentially not a kidney stone, but finding that like, okay, I was always hungry, or again, I'm not having a super balanced diet, and so again, zooming out, I realized that's not going to be beneficial. So kind of incorporating foods that I enjoy, that tastes good, that's healthy, and then prioritizing hydration to kind of decrease that stress and pressure around the food.
Yeah, love it. I love like, focusing on these things to like reduce that stress because I feel like that is always like my number one thing that I love that I can do as a kidney stone dietitian. Like, yes, preventing kidney stones, very cool, obviously, but kind of helping improve that quality of life and helping people enjoy eating and which truly equates to life. Like that's the best thing that we can do as dietitians. I imagine you feel similarly in the type of work that you do, even more so potentially.
Especially how much it all affects everything. Like if we're stressed,
Hmm.
that's not great. If we're stressed, we're not sleeping great. If we're stressed, like nothing's going great probably in our lives. So
Yeah, yeah, absolutely. All right, so as we come to the end of the episode, is there anything else that you'd like to add, or highlight that we talked about? Anything that we missed that you'd like to share with the audience?
yeah, I mean, I think just taking kidney stones seriously, I think is just we need to say, especially for the younger generation. It's funny as we're talking today. I always think of like whenever I go visit my urologist, it's always people, in their late, like potentially 70s, 80s. And I'm always like, why am I here? I must be like,
I do not fit. So one thing is not like the other.
but obviously, when we talked about kidney stones, actually in my advanced nutrition class, like 5 other people that were my age had mentioned like I've experienced it or I always am passing them. So I think just more awareness around it and talk about it, right? Even if it's from our urinary tract, like it's still something that needs to be researched. It's still something that needs to be taken seriously. That we can talk about it, and so I think that's a main highlight. And then getting that support, a urologist is part of the team, but I think dietitians and other support systems can be really helpful just to, again, preventative care, which I feel like is our key word of the day is preventative care.
Yeah, preventative care and just awareness that it can happen to anyone and that it does need to be taken seriously. You mentioned you were sort of that odd woman out at the urology office, which, urologists do a lot more than just kidney stones, obviously, which might contribute to that. But, kidney stone incidence and prevalence is rising overall, and it's actually rising much faster in women. So we are unfortunately catching up to men in terms of kidney stone prevalence and young women in particular. So, you know, just because you feel like you're healthy or like you look like you're healthy doesn't necessarily mean that you can't get a stone, right? Not to scare you, but just to really prioritize, healthy eating and drinking water. That's always the most important thing. We get so fancy and talk about oxalate and calcium and protein, but really like water is by far the most important thing that you can do to prevent stones. So, love those final thoughts that we just need to take kidney stones seriously.
Yeah.
Yeah. Yeah. All right. Well, Courtney, if anyone wants to connect with you afterwards, is there a place where people could find you and reach out if they would like to?
Yeah. I'm currently at Healthier Tomorrows, based actually in Chicago. So outpatient work through them. So that's where they can find me if they ever need support, especially with eating disorder support. Always happy to reach out. We also have a great team in general that does eating disorder support, but women's health and general nutrition and anything
Yeah.
nutrition related, they can get support.
Awesome. Awesome. Well, thank you so much for sharing. And thank you again for being on the podcast and being vulnerable and sharing a little bit about your personal story. I'm sure that our listeners will appreciate it. We love hearing about, just different walks with kidney stones. So thank you so much for being here today.
Thanks for having me.
Thank you for listening to today's episode. For more help with kidney stones, check out my website, www.thekidneydietitian.org. For more personalized help from me, check out my online course, Kidney Stone Nutrition School. VIP enrollment includes help directly from me. I can't wait to see you there and help you prevent kidney stones. Have a great day.